If your doctor told you your blood pressure was 140/90, would you know what that actually means for your health? Many people hear numbers like this during a checkup, but aren't sure whether they're normal or something to worry about. In this video, we're going to break down what your blood pressure numbers really mean, what ranges are considered healthy, and when it might be time to take action. Welcome to Your Health Numbers, the channel where we break down important health numbers so they're easier to understand. Blood pressure is simply a measurement of how strongly your blood is pushing against the walls of your arteries. When you see a reading like 120/80, you're actually looking at two different numbers. The top number, called systolic pressure, measures the pressure in your arteries when your heart beats and pushes blood through your body. The bottom number, called diastolic pressure, measures the pressure when your heart relaxes between beats. Both numbers matter because they give doctors clues about how hard your heart and blood vessels are working. So what counts as a healthy blood pressure reading? Most experts consider 120/80 or lower to be normal for adults. If your reading falls between 120 and 129 on the top number, but the bottom number stays below 80, this is often called elevated blood pressure. It's not hypertension yet, but it can be a warning sign that blood pressure may rise over time. When blood pressure reaches 130/80 or higher, it's generally considered high blood pressure, also known as hypertension. Many people develop high blood pressure slowly over the years, without noticing any symptoms. That's why routine checks are so important. There are several reasons blood pressure tends to rise as people get older. One common reason is that arteries naturally become stiffer with age, which can increase pressure inside the blood vessels. Things like excess salt in the diet, being overweight, lack of exercise, chronic stress, and poor sleep can all play a role as well. Family history can also influence whether someone develops hypertension. A single elevated reading doesn't always mean there's a serious problem. Blood pressure can temporarily increase because of things like stress, caffeine, illness, or lack of sleep. However, consistently elevated readings over time are what doctors pay close attention to. If blood pressure stays high for long periods, it can increase the risk of health problems such as heart disease, stroke, and kidney problems. That's why monitoring blood pressure regularly is so important. The good news is that there are several lifestyle habits that can help improve blood pressure. Regular physical activity, even simple activities like walking, can help keep blood vessels healthy. Eating a balanced diet that includes fruits, vegetables, whole grains, and less processed salt-heavy foods can also make a big difference. Maintaining a healthy weight, getting enough sleep, and managing stress are also important pieces of the puzzle. In some cases, a healthcare provider may recommend medication to help control blood pressure as well. Your blood pressure numbers provide an important snapshot of your cardiovascular health. Understanding what those numbers mean can help you take steps to protect your heart and blood vessels over time. If you're unsure about your readings, it's always a good idea to discuss them with your healthcare provider, who can guide you based on your personal health history. If you found this explanation helpful, consider subscribing to Your Health Numbers for more simple breakdowns of the health numbers that matter most.